if we have to, we can move to our conference line, but I think at least let's try to get through our PowerPoints before we make that move. So I'm going to turn it over to Ginger.
Thanks, Julie. Hi, everyone. Good afternoon on this lovely Thursday. Well, it's lovely here in Austin anyway. Welcome to our first virtual meeting. We really appreciate your time today to stay on task for this NSRP work, especially during these strange days of COVID-19. So just a little housekeeping for best practices. Please mind your mute. So if you have called in or if you're using your computer audio to speak, we'll keep working out the kinks on that. But either way, you can use your mute button on the WebEx application in order to mute yourself. So what you would do is hover over next to your name. You'll see something that looks like a microphone with a line through it. You have to select that and turn that microphone red in order for you to be muted. So we would like for everyone to do that when you're not speaking. That being said, we're about to do roll call, so you will need to be unmuted for that. If you're having issues with your audio during the roll call, please use the chat to type your name and say present or here. That being said, please identify yourself each time you speak. The way people are calling into the meeting, some people, your names are associated with your sign-on, but others, we can't tell who it is. So just as a courtesy, please identify yourself each time you speak. There are some features in WebEx that we can utilize to help the meeting run smoothly. There's a way to raise your hand to ask to be recognized during the course of our discussion. And we're requesting that you use the chat option for communication, not the Q&A function, simply because it's easier for our moderator, our technology moderator, which is Vic Reyna. It's easier for him to monitor the chat than it is for him to monitor the QA. So please use the chat option. So with that, if you have any questions about the meeting or about how to use the technology and this application, the WebEx application, please put that in the chat so we can help you. Otherwise, I'm going to turn it over to David Young for a roll call.
Good afternoon, everyone. So I will call roll, and as Ginger mentioned, we are having some issues hearing some folks. So when you respond here, if I say thank you, that means I heard you. If I didn't say thank you, that means I didn't hear you. And so then I would ask that you indicate that you're present in the chat. Gail Acuna. Nina Almaze. Julie Artiga.
I'm here.
Thank you. Tracy Cooper.
I'm here.
Thank you. Marla Urban Roseman.
I'm here.
Thank you. Nancy Farrenwald.
Present.
Thank you. Jan Hooper. Steve Johnson.
I'm here.
Thank you. Deborah Jones.
I'm here.
Thank you. Linda Lane. Pam Lauer.
Here.
Thank you. Beth Merwin.
Here.
Thank you. Jonas New. Brenda Nichols. Beverly Skloss.
Present.
Thank you. Catherine Tart.
I'm here.
Thank you. Oldie Church. Tetsuya Ume. Sally Williams. Linda Yoder. Cindy Zolneric.
Here.
Thank you. Julie Eklund.
I'm here.
Thank you. Stacy Silverman. All right, and other coordinating board staff, Ginger Gossman.
Present.
Ed Buchanan.
Present.
Thank you. And Emily Cormier. All right, that's it.
Thank you, Emily.
Yes. And who is this?
This is Tetsuya.
Okay, thank you.
We also, I think Sally Williams is on the list, and I wasn't sure if she was able to speak up. Sally, are you able to speak up? I see your name as attending. Okay, let's just note that she does appear to be on the call. She's probably having some trouble.
And David, this is Gordon Taylor. You didn't call me either, but I'm here.
Oh, perfect. Thanks, Gordon. Appreciate it.
Thanks, Gordon. Appreciate it. Gordon, 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 appreciate it.
Okay, well, thank you, everyone. Once again, if you are not muted at this point, please mute for a moment while we advance in the agenda, just so we don't have the echo effect that we had just a moment ago. So you were sent an email by BJ Bishop on April 30th, which contained the agenda for this meeting, followed by materials relevant to the meeting, but also the minutes from last meeting. If you have any modifications to those minutes from last time, will you please let us know now? You can go ahead and unmute and let us know, or put something in the chat if you have any concerns about the minutes from the last meeting.
Hi, this is Jan Hooper. I've joined the meeting.
Oh, thanks, Jan. Okay, well, hearing no issues raised and seeing nothing in the chat regarding the minutes from the last meeting, let's go ahead and advance in the agenda. So I'm going to hand things off to Dr. Julie Eklund to talk about the next agenda item, where we're going to talk about initiatives and efforts outside of Texas that are addressing nursing shortages. Julie?
Thank you very much, Ginger. It is my pleasure to introduce Thomas Michael Henderson, or Tim Henderson, who has joined us today. He's been doing some work for us, looking into what's happening in terms of addressing nursing shortage issues in other states. And I'm going to read a brief bio and then turn it over to Tim for his presentation. Tim is a nationally recognized expert in health professions policy and programs, including state Medicaid payments for graduate medical education. At the end of this month, Tim is retiring from the faculty at George Mason University, and congratulations, Tim. He has been a professor and senior researcher there for over 15 years. He remains active as a health workforce consultant, providing insightful and creditable information and analysis on federal and state programs and policies supporting health professions education and primary care to underserved and low-income populations. Tim has over 40 years of experience in progressive health policy research and teaching, clinical administration, and project management for multiple government agencies and private sector organizations. For nearly 25 years, Tim has conducted periodic national surveys of state Medicaid programs for the Association of American Medical Colleges regarding their GME payment policies. So again, thank you so much for joining us, Tim, and I'm going to turn it over to you, and it looks like your presentation is queued up and ready to go.
All right. Thank you so much, Julie. It's good to be here, at least virtually. I can smell the blue bonnets. At least I like to wish I could. Anyway, so I'm glad to be here, and I'm hopeful that the information that I'll share with you will be helpful. I didn't make any effort to assume that Texas was doing some or all of these strategies in one way, shape, or form, but obviously you will know, I assume, that they are or are not doing such things. So here are the parameters of what I did. I looked at all the states in terms of their legislation in D.C. I did not report Texas for the reasons I think I just mentioned. I included legislation that, in terms of nurses, involved ADNs, BSNs, APRNs, and then doctoral trained nurses. Legislation that I was tracking went as far back as 2008 in terms of what I could find of relevant substance. The full text of these bills was provided to you as a attachment to an earlier email, which you're please more than welcome. And I guess if any of you have looked at those, we can talk about anything that you've seen specifically. Happy to answer any questions on that. The legislation has a combination of both bills that have been passed into law or adopted, bills that have not been adopted, and then there are some bills that are still pending if the legislative session in those states is still active. Also, there are, in many of these bills or laws, there are multiple objectives and in many cases several other professions other than nurses. So obviously I was focusing in on just what nurses were doing in these measures. And largely I focused just on measures that were about improving supply, not so much addressing things like quality or cost. I didn't attempt to go into the regulatory database. That would have been a much more concerted effort. And I didn't have the resources under this program here to evaluate any of the legislation that has been implemented. So what I've done, and this is reflected in the attachment you received, I've categorized the legislation into sort of 5 major areas, which I'm going to sort of walk through in some overview fashion, as you see here on this slide, into didactic faculty or instructional faculty and the teaching environment, clinical faculty and preceptors and training sites, students, educational pathways and partnerships, and then workforce planning, evaluation, and investment. So let's just kind of unpack a little bit of what you see here. As far as the didactic nursing faculty, I'm just going to kind of share some highlights here. There are a number of states that have actually funded new doctoral programs that emphasize nursing education, which you see there. And as you note or have seen, any state that has an asterisk by it means that the law or bills or several bills from those states has been adopted into law. So let's talk about the grant fund here. I mentioned a couple of these here. Maryland's measure that I found provides statewide competitive grants to in part attract and retain minorities into nursing. New Mexico's measure supports, which is a law, RNs seeking employment as educators or obtaining additional education. South Carolina's law supports salary enhancements of current educators and provides funds to hire new faculty. These are grant funds that are supplied to these institutions to support their nurse faculty. Secondly, in terms of loan repayment and scholarships, quite a few states have been active in this area as it pertains to supporting nurse faculty or educators. I know Texas has, of course, a current loan repayment program for nurse faculty, and so this would hopefully be useful to you to see a frame of reference as to where you stand with other states. Just to mention a few of these other states and what they have in mind here, Colorado has a law that pays for up to $20,000 for two or more consecutive years that a nurse is in a qualified nurse faculty position. Indiana does a somewhat similar thing where they're paying up to $25,000 a year or $5,000 a year for at least 3 years in a qualified position, and that includes adjunct clinical faculty in that measure. Maine, which is quite, from what I can tell, a very fruitful law, you might say, pays up to $30,000 a year for up to 5 years and 50% of the recipient's loan balance. Oregon, I think, is an interesting one as well. They will pay up to 20% of any outstanding faculty member's loan, or up to $10,000 a year for 1 to 3 years for those that are earning a master's degree. And up to 5 years, they will pay $10,000 a year for those that are earning a doctoral degree. Educator tax credit. Illinois is the only state that I could find that has a tax credit that supports nurse faculty. The credit there is equal to 2.5% of the faculty member's federal adjusted gross income for each taxable year. Sorry about that. Hold on, please. So let's move on to clinical faculty and training site issues. So you can see I've kind of organized this into 3 major areas. Funding that state funding that goes to supporting new clinical training sites and programs. Then expansion grants that goes to existing clinical training programs. And then tax credits that several states have put in place for clinical preceptors. So I'm going to just go through this and give you some of the examples in each of these areas. In terms of states that have been funding new clinical training programs and sites, Florida has an interesting program where they've established a pilot project to implement new nurse residency programs in these areas, in nursing homes, in home health agencies, and in other designated community-based settings. They're funding those through this pilot project. Hawaii is funding a new nurse residency program at the University of Hawaii, where residents there under this program may qualify for stipends and loan repayment and may be required to work for 2 years at designated sites in underserved locations, as a faculty member, as a preceptor, in certain underserved locations across the state. And then finally, Massachusetts establishes a 24-month, 2-year nurse practitioner residency program at the state's federally funded community health centers, or FQHCs. In terms of expansion grants to these kinds of programs for existing clinical programs, Minnesota provides funds to both plan and implement the expansion or creation of new clinical training programs specifically for APRNs with a focus on primary care. And then Utah has a program that for some time has funded rural residency programs in nursing and other health professions. Again, the focus on rural residency programs. In terms of tax credits and the way these credits work in these states really for clinical preceptors varies considerably. So I'm just going to give you a flavor of what some of these look like here. And all of these are laws that I'm going to mention that did pass. Colorado has a $1,000 a year credit for supervision of not less than 4 weeks a year for preceptors, and the focus there is on rotations in primary care in rural areas. Hawaii has a $1,000 credit for each uncompensated supervision, meaning that the preceptor was not being compensated otherwise. And that would as much as $5,000 a year for, each totaling a maximum for uncompensated supervisions. Georgia is not quite as nice, but it is interesting. They paid $375 for the first 3 preceptor supervised uncompensated rotations, and then $750 for the next 4 to 10, but all of those rotations have to be in community-based settings. Finally, South Carolina will issue a credit to a preceptor for uncompensated supervision for at least 2 preceptor contacts or rotations a year. Then, if that's the case, then the preceptor accrues a credit of $750 per rotation. I know this is a lot to digest, but the details are in the laws and measures I've sent you. Pays up to $3,000 a year if at least half of the practice where the preceptor works, where the rotation is composed of Medicaid, Medicare, and self-pay patients. And then the compensation per rotation is somewhat less if only 30% of the practice is composed of Medicare, Medicaid, and self-pay patients. So let's move on to students. And you can see these are the nursing students I'm looking at here. Most states, including Texas, have some kind of loan repayment program for nurses. I'm not going to get into too much of this because most of these programs, as I'm sure most of you know about, have been around for a long time. And I'm not going to really talk about these here, but most states have them now in some way, shape, or form. So let's move on to grants and stipends. 3 states that I could find provide some kind of financial assistance in the form of grants or stipends to qualified students. Michigan, in particular, awards these kinds of grants to students that are minority, who agree to go back and serve in a health professional shortage area upon completion of their training. And similarly, Wisconsin has a program where the focus is not so much on the student, but the need or desire of the student upon completing the degree to go back and be employed in a veterans home environment. Tax credits, New Jersey has a tax credit. The tax credit does not go to the student. The tax credit goes to the employer who is contributing to the loan repayment for students, nursing students, who agree to work in that employer's setting upon graduation. And then briefly, there are other states that are, shall we say, making special accommodations for nurses, mental health nurses. I know Texas, I believe, has a program that provides support for nurses that are interested in serving in mental health capacities. New York has an interesting accommodation. It's not like that. What New York does is that they authorize, through this law, the state to issue what's called a temporary exemption to nursing students who are unable to begin or complete their BSN due to some lack of access to an educational program. And I think primarily what they're talking about here is there is evidence where the student may have applied on at least 2 occasions to a BSN program and was denied access mainly because there weren't enough seats available in the program. The applicant was deemed qualified, but they could not accept the student given the lack of availability. And the exemption would be they would not have to go back and apply again after those 2 occasions. So let's move on to educational pathways and partnerships here. One sort of category is what states have done to try to streamline the articulation of the ADN to BSN pathways that exist in their states, either for all nursing programs across the state or in selective nursing programs. In California, the state requires these pathways, requires certain schools to implement this degree pathway between their California community colleges and Cal State. And then Maryland revises the transfer scholarship for community colleges, the 2+2 transfer scholarship, and increases that. Now, related to that is the fact that this is probably of no surprise, and I'm not sure where Texas is in this process, is that the state has allowed community colleges, several or some or all community colleges, to offer a BSN or a BSN completion program. Also, and more in the career pathway side, there are at least a couple of states that are, shall we say, supporting high school to college nursing apprenticeship and career pathway programs. Maryland requires is required, to create a statewide media campaign, which is funded by both the state and local matching funds, to promote participation by students and employers in career or technical education and apprenticeships for nurses and other professions that are facing shortages. West Virginia requires that a work group be established to plan and institute a new nursing career pathway initiative. The program would begin in high school and progress through college, providing employment opportunity with the industry partners that participate in the initiative, and to re-enter at certain points down the road if they are getting additional training into those employment opportunities. Common undergrad nursing curriculum statewide. New Mexico has pretty much funded the University of New Mexico to establish programs that coordinate nursing education statewide to sort of manage a common curriculum and to improve outcomes among the nursing programs in terms of students graduating, flex, scores and so forth. Mississippi, interesting little scenario here, I guess in part because it's Mississippi and there are some resource issues, but a law that was passed there directed the Board of Trustees for Higher Education to conduct a one-year feasibility study to look into the idea of nursing schools across the state sharing utilization of clinical simulation labs in order to obviously increase access to many of the schools who don't have as much of those interactive learning capabilities and pooling their resources in their mobile capabilities. And then finally, one state I could find, Washington State, established what I call a course equivalency program for nurses' requirements for their education to be somewhat in sync with, or part in sync with, what paramedics are needing in the way of some courses. I think the assumption here was that it would help to streamline the ability of paramedics and perhaps other health professionals after their respective training to perhaps at some point want to pursue a nursing degree and already have certain courses that were already required for nursing training under their belts. In terms of workforce planning and evaluation and investment, several states, and I wouldn't be surprised, including what you're doing now in Texas, is making an effort to assess where they are with their supply of nurses. So probably nothing exciting there. 4 states, and I guess you could certainly add Texas to that list, has been active in trying to either evaluate or plan for ways to address their nurse shortages. In terms of workforce development and investment, some interesting things going on here. Arizona, even though it is not passed, the bill that was proposed is a fairly ambitious initiative that established, and if it were to become law, would have established and fully funded what they called the Arizona Nurses Academy under their State Board of Regents to provide incentives for students to enter nursing and to commit to practice in Arizona in certain facilities. And so there are lots of other requirements with this measure if it were to pass. The Academy was to put into place a full-scale recruitment, marketing, and promotion plan, track postgraduate service requirements, and then distribute funds between the institutions, okay? And these requirements also included making sure that the Academy provided programs that involved accelerated educational pathway models for critical need areas. It required each institution that participated, nursing institution, to provide each full-time student scholarships with state funding for tuition and fees. Ambitious. I don't know. I didn't see a price tag on that, but I'm sure it was significant. In Illinois, they've established a effort to promote and expand and retain nurses who work specifically in nursing homes. Maine has a general fund that, by law, authorizes a bond issue to be put forward to support nursing education specifically for the purpose of enhancing economic development, I guess, in certain rural or underserved parts of the state. And then just finally, I know this is outside the realm of, most of these here on this last side are outside the realm of education directly, but just so that you know this, I mean, and there are a couple of states that I could find that do provide tax credits for nurses to practice in underserved areas. Georgia, a nurse practitioner is qualified under this, is allowed a tax credit not to exceed $10,000. The credit may be claimed for not more than 10 years, provided the nurse practitioner continues to work in a rural area in her profession. So I've kind of run through this very quickly, and I apologize. There's a lot there, and I trust at some point, you know, most of you will be able to kind of sift through the details of this information in the files that I sent. And but in the meantime, I guess whatever's next, Julie, I'm happy to answer any questions.
Thank you, Tim. This is Ginger. Julie, if you don't have any closing comments, we were already getting questions in the chat.
Yeah, and in fact, I'm not able to see the chat, unfortunately, Ginger, so hopefully you can walk us through that. The other piece I think that's important to mention is that Tim has agreed, as we work through this, if there are particular initiatives of interest, to help us delve into them a little bit more. I think, you know, again, there might be some things such as state tax credits that there might not be as much interest since we don't have a state tax in Texas. There might be others that really have resonated with the group. So I just wanted people to know that, and we appreciate that he's going to be able to take some time. There wasn't time before this meeting, but to take some time if there are particular areas of interest. So that said, I will hand it over to you to work through the questions in chat.
Okay, great, thank you. So, Tim, we had a question earlier on from Cindy Zolniak, and she was wondering could you differentiate whether what you were talking about applied to RNs or APRNs, their clinical experiences, the clinical education models?
Okay, you're talking about those that are students or preceptors. You're talking about students that are in the clinical training?
So unfortunately, I wasn't able to tell which slide Cindy was referring to. Cindy, I don't know if it's possible for you to chime in either using audio or in the chat to let us know what your question was about specifically.
Okay, I just unmuted myself. Yes, it was this slide. Because of the clinical education experiences are set up differently for RN versus APRN students, I thought it would be helpful to separate out what kinds of funding programs are being provided for which type of education program, the APRN or the RN.
Right. Well, the details, and I'd have to go back and look, and the measures that you're referring to that I could find would be the ones in Florida and in Hawaii primarily, because the New York measure didn't really provide the information I think you want. And the Massachusetts measure that I'm referring to here was specifically for nurse practitioners. But the other ones, I don't think there was the detail. I don't remember seeing the focus here as to whether it was APN or whether it was, advanced practice registered nurses or not. I can certainly, it's in there. What I'm finding is some of these measures were specific in terms of being very clear about defining who the nurses were that would benefit from whatever the new initiative was. Part of this is because some of these programs that I'm looking at here, like in this case, were programs that may have been around to some extent in the past, and this was an amendment to an older measure that maybe didn't include some of the details there, or it's there and I just, when I was making an effort to report it to you today, I just didn't note it. But the extent to which they made a distinction, it's probably back in the details of those bills, and I apologize for not having that handy here.
We had another question from Catherine Tart. Catherine, I don't know if you want to chime in, if you're able to use audio. Her question was about whether or not the tax credit for preceptors comes from a state tax versus a federal tax. She's asking because Texas is one of the few states that does not have a state tax.
Right. Excuse me. The credits that I could see for the most part, in the sense that states would have some, degree of authority over this, were state tax credits for the preceptors that are involved. They can measure, they can have some control over that, and were doing so in most of these credits. They were state credits, to the best of my knowledge, and when I saw them. There are other places through here where there was a credit that was not state-based, but that was not related to clinical preceptors.
And Catherine just had a few other things she wanted to share. I don't know, do you have audio, Catherine?
Yeah, I do. Can you hear me?
Yes.
So, we do have a scholarship for our nurse preceptors, but a lot of those are unfunded mandates that go to the university, for example. So that there's a large pot of money that I have learned over the years that is with unfunded mandates. So it's wonderful for our nurse faculty, their students, their children can go to school at the university where they teach. But that's how that ends up. And so I guess maybe kind of thinking through that in a way that, it's the burden goes, I guess, back to the state instead of to the university. And then also, I know New York has a mandate that nurses must obtain the BSN within 10 years of earning their associate's degree in nursing. Otherwise, they risk losing their license. So did you find anything out about that?
I did not. I can certainly, that could be something I could explore further. I guess I didn't sort of conceptualize that in the way that you do in terms of that being, that may be something that will typically may or may not be found in legislation, but could be
legislation, yeah.
in the Nurse Practice Acts of the state, yeah.
Yeah, and then we have the Robert Wood Johnson Foundation funded 9 states. I think it was 2012 to 2016 for the academic progression in nursing. Some of them you've mentioned here, but some of the other states were not mentioned, but every one of them had something to do with moving students forward from their associate's degree into the bachelor's degree. New Mexico, California, Texas, of course, New York. So there's some more things out there that probably we could look at.
Well, let me just clarify. I'm aware of some of the initiatives that you're talking about. That I did run across those, not so much through my legislative search, but through other sources. And I think maybe some of the initiatives that were part of the RWJ initiative being done through support by the foundation that didn't necessarily ultimately become state policy.
Okay.
Does anyone else have a question about the presentation that Tim just made? Any points of clarification?
I think one of the best parts about what you presented here is it's really, there's so many different, there's not one size fits all, right? It's based on what the needs are in those particular areas and how the states want in nursing together. Policy comes together to do the best for the patients that they're serving. So it's a really nice overview. Thank you.
And is that Catherine speaking?
Yeah, Catherine Tart, sorry.
Okay, just making sure for the minute.
And this is Jan Hooper. I just wondered if there was any data on which one of these strategies was most effective or brought the greatest payback.
Right. Well, unfortunately, that was outside the scope of my effort here to sort of look at laws of these that may have actually been enacted, and then to go on and see once they were enacted, to what extent have they been evaluated and are effective. And that's not something that I was able to do.
But that is something that I think we would like to talk about here, which is, are there specific initiatives you'd want him to drill down deeper into?
Right. This is Julie. We felt like there was so much, and we wanted to gather it all for you. It was beyond the scope to look at everything, but if there are a couple of areas in particular that a drill down would be helpful, it's something that Tim could help with or staff could help with. So please do either let us know now, or that's information you can provide after the meeting, and we can sift through it and see if we can, find some common areas that folks would really like us to take a deeper dive into.
This is Catherine Tart. I have one more question. We did have the demonstration project through the federal government for the residency programs for our nurse practitioners. And I know there's a lot of data on that, its effectiveness or not. It didn't have the strength of the senators of those states that kind of move it forward. But there is a lot of data there for that demonstration project. I don't know who may be around on this talk right now to talk about exactly how that worked for us. It was not my college, so I can't speak about it in that regard. But that was a really good program that we were very much in favor of as far as education on the national level.
Were other states part of that as well?
Yes, ma'am. It was, Illinois. I want to say Florida, Texas, maybe California or New York, I can't remember. Deborah, do you remember the states that were approved for that nurse residency demonstration project at the federal level? Because your college was part of that at UTMB in Galveston.
Deborah, do you have audio?
I believe she does.
Okay.
Unless she's lost it.
Well, that's okay.
But anyway, that would be one I would be interested in.
Okay.
And yes, we're happy to take a look at that. This is Julie. I also want to mention that to Janice Hooper that for some reason your chat is coming to just me, and I know you jumped and asked the question. Wanted to let you know it's not that we were ignoring the question. It seems to have just been coming to me, your comment. So I believe you asked one of the questions that you typed into chat, and then the other one had to do with scholarships that end up being unfunded mandates. And I don't know if you'd like to address that also.
She did mention that.
Yeah. Oh, okay, good. Yeah, I'm seeing some private chat here. So please be sure it's public if you want everyone to see it. There's a button on the bottom where you can choose who you'd like to share things with, and I'm happy to see things privately. But of course, if you want us to present it to the group, please indicate all participants. Thanks.
Does anyone else have any thoughts on next steps for Tim and what we may ask him to look at more closely in other states? Okay, if you think of anything, feel free to send that under separate cover to Julie or David Young. But for now, I think it may be a best use of all of our time if we go ahead and advance into the agenda, the next item. And so Julie is going to present to us some information on graduates by levels and the survey results. So this is, I think this was sent to you as well, an email. So Julie, want to take over?
Yes, thank you. And thank you again, Tim, for joining us and for your good work in pulling all of this information together. I know there's a lot there for everyone to sift through, and it's appreciated. I am going to, hopefully now, I'm going to go to where I think I can share my presentation. I'm going to share, and then I'm going to ask Peter to jump in if I need to. I'm going to share a file. Is that correct? No, that's not working.
Sure.
I've got my presentation queued up in a PDF, and I'm looking under share, and I don't think it should be screen. I'm sorry, Vic, you're breaking up.
Share application.
Application. Okay.
And then
here we go. I've got it. Okay, and there. I think it worked. Okay, hopefully everyone is seeing my screen. Ginger, can you confirm that we're seeing the survey results screen?
Yes.
Wonderful. Great. Well, we so appreciate all of the efforts on the part of the work group members to respond to the survey that we sent. What I want to do first, well, actually, I've got survey results here. I don't believe I have the additional nursing information here, so I think I pulled the wrong document. Ginger, I'm going to go ahead and walk through this and then move on to the other documents in the interest of time. And just want to make sure I have that one. And David Young, if you could put that on the top of the list in the folder where we have the meeting materials, I'll grab that next, where we're showing some of the information that you asked for in terms of the different degree levels and what our numbers look like for nurses. But let's dive into that now, since it's here in front of us. First of all, we have a little bit of an overview just to remind you of the work we did, the I think pretty intensive work that we did at our last couple of meetings, but particularly at the February meeting, you all probably recall going through and ranking the challenges that you had raised that we were facing in terms of the nursing shortage, as well as in terms of the nursing shortage program. And then after you did that work, we went ahead and took the results and we broke you up into 3 groups and asked you to think about the top 5 challenges from that little survey we did about challenges and how you might actually design a program. It was kind of a design challenge, how you might design a program that would address those challenges. So we had our 3 different groups. The groups came and reported back in terms of, hey, here's some ideas that they had for how we might address this. We thought it was important after you did that work to share with the full group, not just in terms of a quick reporting back, which is all we had time for, but to share them with everyone so everyone could have a chance to say, hey, I think that's a good idea, or hey, I'm not sure that's an idea that I would get behind. So we sent out a survey in March, and we asked you to rate these different ideas that had come up from the 3 groups as something you strongly agreed with, were undecided, disagreed with, or strongly disagreed with. And we also left it open the opportunity for comments. And we had a whole lot of comments come in, which was much appreciated as well, to really get a feel for what you thought about some of these different ideas. So this PowerPoint is actually going to be walking through those results. We sent you a new version today because we went ahead and we put them in order of which ideas had the highest in terms of strong agreement. We also separate, and this is something we probably should have done before, but it sort of came to us after we did the work because the groups kind of went in different directions. We separated it out into ideas that really had to do with the administration of the nursing shortage reduction program, kind of the administration and the program structure itself, so kind of based on, hey, this is the program we have now and here are ideas to improve it, versus bigger ideas in terms of how can we address the nursing shortage issue. So we did break out in this version those 2 groups so we can look at the work separately in terms of, again, those ideas for program improvement to help reduce the nursing shortage, as opposed to sort of higher level ideas maybe for a different type of program or a real rethinking of how the current program is structured. So the slide I'm on now provides information about what you all reported back on the survey. You can see the program design ideas are on the left, and you can see I've sorted them into those 2 other groups, so the program structure and then other strategies. They were sorted by strongly agreed, but I've also got the information with me for the percent that either strongly agreed or agreed, because I think looking at the blue and green together can really give you a flavor of, hey, do people think this was a good idea or were they concerned? So I do have those percentages I'm going to walk through. I want, as we move into the comment section and we take this item by item, I just want to be clear that the colors on this page have nothing to do with the colors on the comments. So we're going to move into comments set up on a chart, and they're in color. It's not related to the bar across the top, and I just wanted to make that clear. I pulled those bars in just as a kind of a reminder as we go through each of these ideas how it was scored, and they are in the order of what was scored the highest in terms of strongly agree, again, in those 2 different groups. But I just wanted to make sure people are clear. Blue on this screen has nothing to do with the 13% in terms of people who said somewhat agree. This is new software for us. We're using Tableau, and we've actually laid this out so that we have the comments coming back, and this is something called a tree map. But basically, they are somewhat grouped. In some cases, the grouping I don't think is fully effective. But the idea was to provide a space of equal weight for each comment coming in and to do some groupings as we could. So as we walk through, you might see some things that seem like opposites that are grouped together. Some of it had to do with grouping with the same idea versus grouping with different ideas. So you might see a yes and a no in terms of support or non-support in the same color in some cases. And we apologize for that. We were trying to do the best that we could with it, but I think the idea is that everything is equally weighted and the colors may help with a little bit of some type of grouping, but you really should just look at the comments as a whole to get a flavor for what people were saying about each of the ideas. So what I would like to do, and just so you could have it, this page here, this is page 4, this has just the information in terms of how many people reported back on the survey, what we got for results, and what the responses were. So if you wanted to get an overall sense. And yes, Ginger?
Julie, yeah, I just want to chime in real quick. Is it possible for you to increase the percent in the viewing of the PDF just to see if we can see the fonts a little bit better? Because it's not legible on a laptop. But you can also please know that this was included in the meeting materials that sent out to everyone from BJ, and you can follow along in the packet.
I'm seeing quite large on my screen, but apparently that is not what's happening on your screen.
Okay.
So I was sent to everyone, and
now that made it bigger.
Oh, did that help? I just opened my laptop and closed it. I'm working from a big screen set up at home. So let me see if I open the laptop.
And this is David. This is David Young. Here's another tip. If you have a list of participants open, if you close that out, that will allow more screen space for the PowerPoint. Okay, and that it's not allowing me to see that, so I'm going to make it smaller at first and see if I can. No, I'm not able to see the list of participants on my screen. Let me try. And actually, Julie, this is for the attendees. They can close out the list of participants. We're not seeing your list, so that shouldn't impact it. That makes sense. That makes sense. And I'll go ahead and read out those percentages when we're on each one, David, if you think that would be helpful, and Ginger. And so folks can hear that in terms of, so they aren't trying to have too many things open at once. I'm happy to share those responses.
And Julie, each individual listener.
This is Catherine Tart. Right on the very top, Julie, you'll see a little hand and a minus and a plus. Touch the plus, and it might. Okay. There you go. Good job. Thank you. I don't spend a lot of time in PDFs, so I tend to be a Word PowerPoint. We know all about this. Thank you so much. Yes, we're all learning as we work from home on these types of things. In fact, I could even go a little bigger there. Let's see if that works as we move down. I don't want to make it so large people can't see the full screen. Okay. So is that too large? I feel like that's a little too large, or does that look good to everyone? Perfect. Okay, great. Then let's work with that. I'm going to then again very quickly go back to just our slide that indicates that has all of the items on it and what the responses were. And again, we had a pretty good response rate, especially during this time that I know is very busy for all of you. So the item that came out on top was simple, clear, transparent timeline. And, you know, in some ways this is kind of nice because I think this might be the most straightforward thing for us to work on. We did have folks who thought it was already clear. And I do know that Mr. Buchanan provided an update, and that could be what some folks were referring to. We did provide a new timeline at the January meeting, but I think there's always room for improvement even beyond there. Clearly the message is let's make sure that our timelines affiliated with this program, whether it's what we have now or if there are some changes in the future, let's make sure they're very clear and transparent. So, and even thinking about as we talk about revisions, laying out what those would look like in terms of how the timing would work, because I do think that's very important, and clearly everyone agreed. So we had 94% thought it was very important or somewhat important for us to address that, or they strongly agreed or somewhat agreed. I don't know that there's too much else here that we probably need to talk about for this particular one, but why don't we open it up for questions if anyone does have questions. And I am not able to see the chat now that I've got this big screen, so I'm going to rely on Ginger to jump in if there are questions that are coming up on the chat. So I assume this is something that everyone is on the same page about, so to speak.
We don't have any questions in the chat. Okay, then let's keep moving, since we do have some
some other items that I know there will be more discussion. So the next one, we had a couple items that had to do with weighting factors. So you'll see they ended up together in terms of the scoring. One of them was just to weight factors, and one of them was to weight initial licensing. And I think something that's important to remember is we had 3 different groups working on this, so you may see that there's some overlap in items. And to me, it sent a strong message that number 2 and number 3 were these 2 items that had to do with weighting. That on this particular one for weighting factors, we had 100% say they agreed or strongly agreed in terms of the response. And then when we moved to the one that had to do with weighting initial licensure, we also had a very high number. We had 82% who somewhat agreed or strongly agreed. So just wanted to point that out. I thought that was interesting. I'm going to open up the first one here. And one thing I thought was really interesting on this one, and you can see in the red on the bottom, is that we had feedback that indicators of quality are essential, and that this should be part of this should be quality indicators, and that we want to provide incentives to improving the quality of the education for students. So that was clearly a common theme in terms of weighting factors, although quality wasn't mentioned in the actual item that came up here. And even if you look at the blue box on the right, yes, we see quality, also retention rate, NCLEX rate, some mention of demographics there. I think that's the only person who mentioned that, but I know that's something that came up in the meetings. We also saw in the gray area, you can see mention of the NCLEX. So folks think that that's important. You'll see throughout this that there are comments about the RN to BSN, but I think clearly in terms of weighting factors, here what's included is that increasing initial licensure. And on the next item, where it really was just about initial licensure, the message that I was reading in all of this is that clearly that's the most important part. There are differences of opinion about how the RN to BSN might be handled. So I'm going to leave it at that and see if we have any comments about this slide to start with in terms of weighting factors. We did have someone who wanted more explanation, and again, the folks that were in that group might want to share what they were thinking about with weighting, but I think the increasing initial licensure, pass rates, and retaining faculty were the 3 factors that the group was addressing here in terms of weighting, having some kind of heavier weighting for those areas, or being sure that those are weighted as the most important. So I'll open this one for a minute too, so you can look at these about weighting initial licensure.
And Julie,
go ahead.
Yes.
Yeah, this is David. While we're waiting, if you want to see the chat, if you hover over the bottom portion of your screen in that black area, you'll see several options pop up, and one is kind of like a little circle, and it says chat. If you click on that, you should be able to see the chats.
I was able to see it before, and then when I went to share my screen, it disappeared. Let me see if I can.
I gotcha. Okay.
Find a way to bring that back in. Unfortunately, yeah, I think for this to fill my screen appropriately, I need to have that minimized. It's not showing. I've just got my PDF that's here. Let me see if I. Oh, go ahead.
Still no questions. But someone was no questions in the chat so far. But someone had chimed in earlier that wanted to say something. So please identify yourself. And
This is Jan Hooper. I just wanted to say that I've been working with a committee at NCSBN looking at quality indicators of nursing programs and risk factors. And one of the quality indicators, which would be directly related to students staying in a program and graduating, is the retention of faculty. One of the quality indicators is consistent faculty that stay with a program.
Okay. Thank you. I'm glad you mentioned that, because one thing that I didn't mention, and I think it was important to mention, so I want to do that moving forward as you're all making comments and suggestions, is that we're going to go ahead as we move through this presentation and keep notes of your responses, because for our next meeting, we think it's important. We're getting closer to our deadline. We think it's important to get a little more concrete at this point. And our plan is to put together a straw man to get out sort of what a program might look like, to get out to all of you before we have our next our next meeting. I think we might have one that's focused on some of these program-related issues in terms of how could the program be redesigned, what might it look like based on all the feedback you've given us. We may have some additional pieces regarding other areas you could explore in terms of ways to reduce the nursing shortage to think about. But I wanted to let people know that as we're reading this, as we're listening to your comments, we will be gathering all this information together to try to put something together to share with you before the meeting, so that then you can share comments back on something that will be more specific than what you're looking at now, but based on that and based on our conversation. And I also, will open it up to if folks want to send their own ideas as well for what a structure might look like. But I did want to make you aware that that's something we're listening for and thinking about as we move through this. So again, I'm moving into the planning for the next meeting phase, but I thought it would be helpful for you to know that we are trying to get more concrete. So thank you. I think that in terms of the retention of faculty, consistency of faculty, that's an important point. Anyone else want to weigh in on that, either through the chat or comment? Is that a piece that yeah, go ahead.
This is Catherine Tart. We did a huge study years back to show that we had to have enough baccalaureate prepared people to go into nursing education to achieve the master's degree. And the RN to BSN is a pipeline for students to earn the bachelor's degree so that they can go on to the master's and higher. So that research is just very, very strong in our state, and it may not be what we want to do as our priority for this funding, but I don't think we should ignore our RN to BSN work that we're doing for the state. So I think it should be part of it, but I think the quality piece is what helps us in anything that we do. So if we can develop those criteria for quality, then I think that would be a really good thing.
So go ahead. Yeah.
This is Steve Johnson. I just want to echo that. I mean, I think clearly the pipeline to the MSN is going to be critical. And so the RN to BSN programs, I think, still need to be considered of value. I think the other thing I would point to is, initially when this program was created by the legislature several sessions ago, the idea was behind professional nurses, which wasn't just increasing the overall supply, although that is part of it. There was legislative intent, from my understanding, that focused on, more professional nurses. To my mind, that meant leading more to the BSN. But I do think the measures of quality are critical.
This is Beth Merwin. I really support the last two speakers of how important RN to BSN is, particularly as a pipeline to leadership positions and graduate program supply and ultimately our educator role. And I really would also support more work and ease of regulations to support the articulation and streamlined approach from community college RN to BSN programs.
Hello, this is Linda Lang. I agree that the RN to BSN programs are important, but you also have to remember that it's a very lucrative program on its own. I mean, there's no clinical involved. It's all mostly online, and it's just by itself, it more than pays for itself. And I don't think this funding is appropriate for it.
This is Catherine Tart. There is clinical, there has to be clinical. That's part of the accreditation process. So they have community health, they have their leadership and management, they have the courses that for their advanced health, there's health assessment towards moving them towards the graduate degree. So they're very strong clinical components, and there should be. If not, then they're not following our accreditation standards.
Okay, any other comments as we're talking about the initial licensure and the RN to BSN components? I think based on the survey results, again, this was presented as weight the initial licensure more. We had some folks who weighed in and thought it shouldn't be, the RN to BSN shouldn't be part of it. But it looked like in terms of agreement with it being weighted more, we were at a pretty high percentage there. So we're at 82%. And on our earlier slide that we were looking at, where we were at 100% with people agreeing that we need to be weighting factors here, and initial licensure was one of those. So I am thinking that if we're thinking about some kind of a straw man, that it would more highly weight the pre-licensure, so the initial licensure. And I'm hearing from the comments today that's definitely an interest in the RN to BSN, but some concerns about that as well. So anyone else want to weigh in right now? It's clear that the weighting, the message is the weighting should be heavier in one direction. How do we want to see it overall?
We can. Yep. This is Cindy Zolnaric with TNA, and just you know, in 2009 when this program was redesigned, the focus really was on the pre-licensure programs, and it looks like the survey results confirm that there is a need to continue a focus there, not to the exclusion of other programs, but that is a primary component of the nursing shortage reduction program. Thank you.
Thank you. Okay. Well, again, we appreciated everyone's response to the survey and the comments now. The piece that I think maybe didn't come through that it's helpful to hear is the piece, that pathway piece, or I think it was in one comment, the pathway piece in terms of the RN to BSN and then on to the faculty. So I think thinking about that pipeline and wanting to strengthen that, that might just be a piece of the puzzle as opposed to the bigger piece of all RN, thinking about all RNs to BSN. So that's something we'll do a little thinking about, and if anyone wants to provide some feedback to us, it would be helpful. I don't know if there's any data out there about students who do take that pathway, who start out with the RN, then move to the BSN, and then go into to the professional, the higher level, the graduate nursing programs with the intention of teaching, but we'd be happy to get additional information on that if someone has it. Okay.
This is Catherine Hart, and we do have that data with the deans and directors. You know, I don't know where you, and I know it was Beth Mancini that brought that forward, and I mean, that was the piece that just made us sit up and say we will never get rid of our faculty shortage if we don't have enough people who can even get into the pipeline to become nurse educators. And that really was, I mean, every single community college, every single university, we all understood that. So let me see if I can't dig and find that. I know we had charts and everything with regard to that. And
I apologize. It's something we shared already. It might be a piece that it wasn't paying full attention to, but it would be, given the conversation, it'd be helpful to have that. Thinking about the pipeline and the waiting. Oh, okay. Yes, all right. Any other comments on the slides about waiting? I think I feel like we're getting a fairly consistent message. I understand there's going to be differences of opinion, and of course everyone will have the opportunity to chime in again as we try to get more specific with a straw man approach, which would be, putting together, here's what a program might look like. Everyone please go at it and let us know what you think is good and what you don't. So,
Tetsuya, did you want to chime in? He sent a message on the chat that says that he values the RN to BSN programs, but still believes that. Can you hear me? Yeah,
oh, yes,
we can. Go ahead.
Yeah. Oh, okay, I'm sorry. Yeah, I had an issue with. Yes. This is Tetsuya. I really value RN to BSN program But if we don't have pre-licensure graduates, then we won't have many RN to BSN students either. So I think it's very important to focus on the pre-licensure graduates as well.
Thank you. No, appreciate that feedback. I want to bring us one more time back to these quality comments. We'll see them come up in other places in terms of, making sure we have what we're weighting is going to be something that's a quality indicator. Right now, I think people are aware of how the licensure testing fits in terms of whether institution falls into the over 70 or under 70. But I'm curious in terms of, and hopefully I understand it correctly, but how might one think about if we wanted to do some kind of passing rates? Is that something it's worth pursuing to have it be even more direct for quality in terms of what we're seeing for passing rates? Or is that really, not the direction to go in? It's just important to keep in mind that those rates are an indicator of program quality.
Julie, this is Jan Hooper again. I'm sorry to keep going back to this Committee on Education Outcomes and Metrics, and we're going to be publishing that data next month, but I'll see if I can get a list of those quality indicators because we were really looking at what other things besides the NCLEX really should be considered when we're thinking of program approval. But a survey went out across the country to educators, practice people, and regulators, and NCLEX still was way up there high, so it still needs to be considered. But I will send you those quality indicators just so you can see what came out of 3 different research studies.
Excellent. That's very helpful, and I appreciate that. And I think the message is to be thinking about that as we're developing our straw man. Okay.
This is Beth Merwin. A follow-up question to, I believe that was Jan Hooper. In addition, when that report comes out, will there be benchmark data available for the different metrics?
Well, the plan is we have also developed a data form to go out to collect national data of programs and then to weight these different areas that came back from the Delphi study. So yes, the plan is to have a scoring so that we can see when programs have risk factors and try to help them early on instead of later. There's going to be a whole supplemental journal coming out in July.
Okay, thank you. And of course, we need to think about it in this program, unless it's going to be structured very differently, being able to have
Absolutely.
The ability to
It's
measure.
just nice to see things that this might validate some of the things that you have because there's a lot of similarities.
Wonderful. No, that's here. Okay, well, in the interest of, sorry, another comment.
This is Catherine Tart. Dr. Hooper, you always talk to us about the self-studies, and and I don't have the whole list, but I know you have a list of some of these quality indicators that you can see have made programs have better test scores, honestly, right? So that may be something that we could begin to look at in the shortness of time based on all the work that our education consultants at the Board of Nursing have been able to see, because you all have like a bird's eye view over the whole state. So
yes, every October we give a report to the board members of our analysis, what we learned from the self-studies, and that is also available to programs so they can start kind of benchmarking their own programs against those qualities. But I can send those over to Julie. It's just a matter of looking and seeing that a lot of different people find the same thing, and then those are the most important things.
Great. Thank you very much for sharing that. All right, I'm going to move on if that's all right. And always know you're welcome to send feedback to us at any point, either during a meeting or during the year, as we're working through all of this. So as you're thinking of more things, feel free to send information, and you don't have to wait for us to survey you. So the next area we're going to be moving on to is actually, and I'm going to make sure I got the right page here. we've got annual funds. Okay, annual funding with no refunds. Now, this was a very program-specific area, very concrete in terms of right now, you know, we have a program where institutions have to refund the data back to the coordinating board if they don't meet benchmarks. And we had some people who were very supportive of this. We also had some interesting comments. I'm looking in the orange box. Once the funds are given, they should be expended. They should be expendable, and that the program creates hesitancy for administrators in terms of spending the funds because of fear of having to return them. And I think that this idea, again, would be that the funding would be structured in a way that the institutions receive it and know they get to keep it. And I do want to mention that we copied these in exactly as they came from you. We didn't want to be trying to paraphrase anything, so you might see an occasional spelling error or something that sort of ends in a partial sentence, but we did want to make sure we were representing what you sent us. But I do think that, again, when we look here, we're at 73% for people who agreed or somewhat agreed, but we also had 20%, which was fairly high for folks who strongly disagreed. So, oh, no, I'm sorry, this is somewhat disagree. So we had undecided, somewhat disagree. I'm sorry, we didn't have any strongly disagree. So the message I'm taking from this is people are definitely interested in thinking about something where the money is not being advanced and coming back. I think as we had these conversations earlier, it was clear, and we know from our data, many schools were waiting until they'd heard if they'd actually earned it before they spent it. So even if the money came in a year or two before, institutions were waiting. So I think we can see fully support. It seems to be the major negative issue. When someone says it seems like no oversight, I think the idea would be that if something is structured, their institutions would have to meet some kind of metrics. So I don't think the idea behind this, and I'm speaking for the group and who put this together, they can jump in if they feel otherwise, but I think the idea would be that the funding would be based on some kind of concrete metrics that an institution reached, so that when the funding was distributed, the institution would know it was theirs to spend, and they wouldn't have to wait for additional metrics to come back in to be collected in terms of earning the funds. That was my understanding of what the conversation was around this. So let me just open it up and see, again, because it wasn't as strong a response as for some of our other items. If anyone, again, thinking about the fact that we are going to try to create some kind of a straw man to bring forward, what I'm seeing from this is think about if there's some way to do this where refunds aren't involved, but let me know your thoughts.
This is Tetsuya. Can you hear me?
Yes.
Okay. I originally thought this is amazing things to do, but now I have a mixed feeling because I think that I trust everyone, but if we do not need to return the refunds, then we can say we are planning to accept 10, but we can claim we're going to have 20. And if we don't meet the criteria, we still do not need to refund, right?
Yes. So I think the idea behind this, and again, some people responded to it differently, would be that you would have to show that you had achieved something, and then you would get funding for achieving it, as opposed to you wouldn't get funding for saying, well, we plan on having 100, and then if you had 10, you'd still get to keep the money. It would be you had 100 graduates, or you had 100 enrollments, and at that point, you would be the grant would come to you to spend for your nursing program, and there wouldn't be any money that would need to be refunded because you'd earned it at that point in time, as opposed to being given it in advance and having to earn it over the next period before and prove that you had done what you had planned. Does that make sense? So I don't think the idea here, and I'm going to ask the group to correct me if I'm wrong, I don't think the idea was that the money would be advanced in terms of institutions saying what they plan to reach in terms of metrics. It's just the metrics would be rethought, so an institution would have to reach metrics, and then they would earn funding that they would be able to keep. Anyone else want to jump in? Have I got that right? Is that sort of where people were thinking? Or maybe if you could just write into the chat box that yes, that's the case, or no, it's not. I know not everyone agrees, but I did think that that's what people were thinking about in terms of the funding without refunds, that structure something so that institutions, once they've earned the funds, can keep them. We see some comments about at least a 2-year cycle. We've had comments about aggregate outcomes. So we see that from another group, I believe. We had a suggestion around aggregating over 2 or 3 years. So some different ideas here. Okay, well, I'm going to continue. Oh, go ahead.
Julie,
yes.
Ginger. Tracy Cooper sent a message. Tracy, I don't know if you're able to chime in on audio, but she says one option we discussed is that funds would be based on the 2 to 3 year cycle, which you just spoke about.
Yes, I think that idea would bring some stability. So funds would still be advanced, but it would be based on not on a year-to-year cycle, but an average, basically, over 2 or 3 years. Thoughts on that? I mean, this is really a core point just in terms of program administration. I will say we've had some real challenges with the way it's structured right now in terms of this piece, in terms of administration, but we want to make sure we have something, obviously, that works for institutions and that's effective. The way it's structured right now, it's hard to say it's been effective when so many institutions do not use their funds until the point where they've actually earned them a couple of years down the road when the metrics show, yes, you can keep the funds. And I know some folks said that some folks said in an earlier meeting that some of that was their administration making those choices in terms of use of funds. Okay, Catherine, well, please send feedback to this one. Oh, good. You got anything else?
Catherine, did you want to chime in?
Well, I still am hearing, that nursing doesn't have oversight for the use of the funds. So I don't know how to make that clear, but, that may be part of the quality too, right? But it's impossible. It's impossible to use the funds if nursing can't use the funds. I mean, it's almost an oxymoron. So there's got to be some sense of way that we know that those funds are being used appropriately, because there's fallout in the community.
Thank you. Yeah, I think making sure that a program, it's very clear that those funds are for use by the nursing program, so there's no question about that, if I'm hearing you correctly. Okay, well, why don't we keep moving, because I see the time is going quickly, and that's what starts to happen when you start to really get into the details of all of this. But I'm going to skip over when we talk about build-in maintenance of quality. We've already talked about quality a lot. I mentioned earlier that it comes up in some different places. Some people weren't sure exactly what this meant, but I think our conversation earlier started to get to some of that. And we talked about quality indicators and how important quality is, so we will definitely keep that top of mind as we're thinking about this, and hope that all of you do too as we move into our next phase. 3 to 5 year rolling average. And if there's anything else on quality, I'll maybe pause for just a moment. I don't want to move too quickly, but I do feel like we had a robust conversation there. So if not, we'll move on to the 3 to 5 year rolling average. And this is basically would be again, we've just talked about this. Is this a way to help looking at the data and add some consistency? So thinking about that, there's not a lot of consistency for institutions. There's a lot of variability year to year, especially with if the money is paid up front, it makes it paid in advance. It does make it challenging. So this was a suggestion I think that came up more than once in terms of a way to manage that. So I think we'll take a look at that. One of the items that brought this up said that we might want to take a look at what data actually would have looked like in the past if we'd done something like this, and I thought that was a good idea. So we'll take a look at that and see if there's something we can do with looking at, if something had been smoothed over 2 to 3 years, what would it have looked like in terms of outcomes, and see if it really does seem to make a difference in terms of what we're seeing from institutions. Please put something in chat if you think that's a good idea. I don't think we need to stop on that. The next one is we have 2-year upfront funding. So this is the other side of the coin in terms of the upfront versus you get the funds after you earn them. And so this was interesting too, because this one we had 81%, but this is for 2-year and not 1 year. So I think people like this idea of, hey, if we could get money for a couple of years up front, we'd have more confidence for hiring a faculty member. We would feel more secure. I think this is an interesting idea. There was a lot of support. Does anyone want to weigh on this, on this? And certainly looking at might not be practical financially. We can look at some of those pieces from our perspective and explore that. But just overall, this idea, I see a lot of support. Any comments or questions about that? Because you may still have some of the challenges we were just talking about. The message I'm getting is people feel like, well, maybe they would be fewer. All right. Then I'm going to continue if no one wants to weigh in here. Again, we've got a lot of pieces we're going to try to pull together for you, but I want to make sure everyone has had a chance to really see these responses. This one, we really didn't get nearly as strong a response in terms of combining the 3 programs. We have over half who were undecided or disagreed or strongly disagreed. We had 47% overall who somewhat agreed or agreed strongly, and really just 20%, which is quite low when you look at our other survey responses. So it seems like combining of the programs may not be the most effective from what everyone is seeing, or at least not in terms of the way they're structured now. We do have some people say, no, maybe 2 programs, but not 3. People would like to discuss this. It might help with the application process. Some people did write in, it's very hard when we've got more than 1 program going on at our institution and we're trying to manage all this. I think that's the blue box on the right in the bottom. Schools have several programs to keep track of, and there's a lot of redundancy when you have more than 1 program. So kind of mixed feelings across the board in terms of this. It's one of the more obvious things you can think about doing is saying, do we need to have 3 separate programs to administer just something to share. So I think that the number of programs and in terms of advancing money up front are 2 of some of the most controversial things that have come up, but I see more concern about the combining that I did in terms of thinking about is there some way to adjust how the money is advanced or whether it is. Again, if I'm off track in my summarizing, feel free to write and let us know or put something in the chat box. And here's a comment that really resonated with me. Simplifying the process is more important than combining. So that was a message that I really wanted to take away from this. And again, add something to chat if you agree with this, that really taking a look at it. It doesn't necessarily mean it has to be just as complicated, even if there are still 3 programs. So I think that was well articulated in terms of this item. At least that's what's resonating with me. So we'll take a look at that piece.
We're getting some chats that people are saying that simplifying is much better, and that does resonate. We also had a chat on the last page, on page 11, that came in right when you started with page 12. I don't know if you want to go back or just wait.
No, please do. Yeah, please.
Catherine, you want to talk about faculty lines need base funding? So adjunct or short. Yeah.
Sure, this is Catherine Tart. Just, we have to be careful with this money, because it's not always coming in, because it depends on what's happening, right? So when we put faculty lines, permanent faculty lines under this soft funding, it can go awry for a community college or university. So, I mean, as long as people know it's maybe adjunct or part-time or short-term, visiting professors or something of that nature, but people have to be really careful with those programs that, that the permanent tenure track positions really need to have the base funding and support. So it's just something to pay attention to in that that one slide that you have a little bit before. Yeah, this one, 2 year. When I heard people saying they're hiring on this, it kind of made me a little nervous.
Thank you. What do you think about if there were some thoughts about, as we're thinking about recommendations, some kind of recommendation that you pull the sort of the faculty piece out and think about the funding for that in a separate way than thinking about the funding for the program overall, that thinking about is there something that can be done to help the shortage that really is very much directed at hiring permanent faculty that isn't going on right now? Because
if there's something for permanent faculty, I think any university or community college would be jumping for joy. But when you have soft money, we do need our adjuncts. I mean, our adjuncts are critically important, so they help us expand our programming, and so the money is helpful there. But when we say we're hiring faculty based on soft money, it doesn't seem like that's prudent.
Okay. No, thank you. That's helpful, and even thinking about if institutions could rely on this for adjuncts and have a little more confidence in using other dollars for permanent faculty, again, thinking about how it's structured, because I do know sometimes if they're waiting for to find out if money is earned, there's even some concern there. But it's, important to think.
Or if they're using the money to hire faculty in other programs.
Right, because obviously NSRP
using this money to hire faculty in other programs. So
well, I don't think that's supposed to be happening because you do have to report to us how the money was used. But yes, but I understand, and perhaps you're trying to say that because they know you're receiving this money, that other money is being used for other purposes rather than going towards your program. So if that's the case, yes, that's something we can.
Who knows? I don't know what there could be all kinds of things, but that's what all I'm saying is if you have a faculty line that's a tenure track that you want as a permanent line, this should not be the money for it. Because it is soft money. It's based on so many factors. So I think we put our faculty at risk and our programs at risk when it's used in a way that it's not used for the soft funding.
Thank you. Yeah, and I do think you can go back to that when we provided the information about how the funding is used because it's reported to us. You can go back and see what % is being used for faculty, but I'm not sure we broke out adjunct. No, thank you. That's very helpful. I am going to, in the interest of time now, we're moving into the items that are sort of go broader, and I feel like they really fit in with what Tim was presenting to us, and that it might make sense for our next meeting. We've got 3 areas here that where ideas were raised about that were sort of beyond the program administration. And I know that Tim was able to provide us with a lot of what's happening in other states. To me, that these things all fit together, and that it may be worthwhile to spend a little time sort of thinking through what these pieces are and what they might look like in terms of recommendations. So not taking them each one at a time today, but thinking about, here we have some broader recommendations about things that can be done. Tim is going to follow up on a couple of the things you were particularly interested in, so we'll have a couple of other ideas there. Does anyone have any thoughts on how to best gather that information together in terms of thinking about recommendations?
Julie, are you asking for information or suggestions on how to collect what should go into the straw man?
Yeah, I think I'm thinking about, should we, try to, maybe for the next meeting, we could do a straw man that's more focused on thinking about a program that might be more similar to what we have, but ways to improve it. But then we want to make sure that we spend some time thinking about what other states are doing and some of these other ideas and how do we tie those in. I think it would be very hard, as I said at the beginning, I think it would be hard to have a straw man unless everyone was clear, no, we want to move away from what we're doing now to this whole new idea. I think it would be hard to have a straw man that incorporates both, but I think we could have a straw man in terms of here's a way we might restructure something that looks similar to our current incentive program but is simplified and improved and all of that. And then here's some additional recommendations or one or two additional straw men for here's something as a state that we think would also be helpful for the shortage. Does that make sense to folks?
This is Cindy Zolnarek from TNA. I think that makes a lot of sense, and I like kind of the two buckets, taking what the recommendations are for improving the program. And then I would really like to spend more time maybe fleshing out some of the details from the work that Tim did on identifying what's been done in other states and looking at which of those would seem to fit with Texas and seem to fit with the needs in Texas that might also be pursued perhaps by, as a legislative initiatives that could be very focused, say, on faculty or funding preceptorships or some of those other issues. Because I think that data is, now that it's been at least identified, I think we could really make good use of that.
It's just model urban enrichment, and I agree with Cindy there. And I also want to make sure that these are not unfunded mandates, because that leads to greater burden on the university.
Understood, Marla. Thank you.
So this is Ginger. I'm thinking, how would you want to get that work done, like digging into the other states and what they're doing? How would you want to get that work done before the next meeting? Do we have folks who'd be willing to dig into that as like a subcommittee, or we could host another WebEx as specifically looking at states that you identify as of it being of interest? What do you think is the most efficient way for us to do that? So we're ready for the next meeting.
I guess I'm wondering about a subcommittee and if there would be folks who might be interested, and we might also want to pull in, if we are talking about a legislative initiative, if it might be appropriate to pull in lobbyists if we have them to help in that discussion, who have better understandings of all the funding sources and et cetera than I may.
This is Julie. I just want to keep an eye a little bit on our schedule in terms of where we're trying to be with all of this. And I wonder if it would be worth, rather than some kind of a formalized group, if it's something that we could, folks would be willing to have a few assigned to us, to groups of folks, or just to, rather than have one group try to sort of look into all of that, everyone could look at a few of the bills from the other states and let us know if they think they're worth digging into more, and then we can sort of decide from there. Or we could even do a quick survey and say, here are the things we brought to you, similar to what we did today, do a quick rating of what you think might have the most potential for us to do a deeper dive. Again, just trying to think about your time and having 1 month before our next meeting. Again, I think a work group is okay if you feel like you're going to, be able to tackle this in that amount of time.
This is Nancy Fahrenwald. I like your idea of doing another survey, because if we can tease out some of these and not invest time, in those that people aren't interested in anyway. That will save us all some time. And then I also like your idea of maybe having people volunteer to be part of a small group to look at a couple of them. That would certainly be feasible.
This is Catherine. I think these are all really good ideas. We really should use the data that Tim brought to us. It would be very interesting to do that.
Okay, well, we could certainly, do something like put together, say, 3 people where we had one person from a university, one from a 2-year college, and one from an organization, and say, hey, for you 3 folks, we're going to ask you to look at these, 4 pieces of legislation, or even just thinking about Tim's slide. If you could take this one slide and explore, preceptorships or whatever the case may be, we could do something like that. After surveying and to rule out anything people have no interest in. The tax credits might be a good example, but I think we could certainly do a quick survey and then maybe assign what people are interested in. And then after they've done a little work, we've got Tim to give us some help to maybe the areas that people really see some potential after they meet in their little groups or review in their little groups. They could let us know, and we could do the deeper dive on those and really try to determine, hey, did they work? Reach out to those states and try to get a sense of how it was working, whether it was effective, whether there are things they would do differently, that type of thing. Does that sound okay?
Sounds good.
Okay. Well, put in chat if you don't think so. It seems to me that's a way forward. That's kind of a compromise between having a formal work group or, just doing a survey or something. So that way, people can do as much or as little as they want. We will attempt to do that and to parse this out so that everyone has a chance to dig into a couple. And again, I do think it was really Tim did a lot of work to pull that together, did surveys and a lot of other, to try to make sure we captured what's out there. So I want to put it to good use. All right. Well, thank you. Ginger, I'm going to, because we're down to 9 minutes, I can try to pull together that data. I think it was shared with everyone. It was pretty much just some simple data, just showing, I think people had asked at the last meeting, I know we spent a lot of time sharing data. People had asked what the breakouts were in terms of where we were seeing the completions, if I remember correctly. If anyone would like me to try to go in and walk through that, I can. Otherwise, I could just ask you all, they were in the materials that we sent, to take a look. And if you had any questions, to let us know, or if you see anything there that you think is really relevant to our conversation, feel free to send something and we'll share it at the next meeting. Does that sound okay to everyone? Again, I'm happy to do it. Does that sound good? Okay. Oops, now I've lost my screen. Okay.
Well, Julie, this is Jan Hooper again. I think this information you put together for this meeting is extremely valuable, and I think we're starting to get down to having some really important items or criteria that are going to be used. So now that you've gone over this and with a good discussion, I want to relook at all of this, and I think everybody else will too, and then we can get some notes to you.
Perfect. No, that's really helpful. Yeah, I know it's hard to get something in the mail and process it, so it was a long time going through slide by slide, but I think it's helpful. I've seen different things as I've looked at this, and I do appreciate all of you for providing this feedback because it's just very, very helpful moving forward. So we will then. I'm going to hand it back to Ginger because I think, Ginger, we're ready for the next step part of the meeting, and obviously we've jumped in and planned for some of that, but sounds like folks are good with the materials we've provided and just getting in touch if they have questions about the data we shared. So back to you.
And Julie, this is David. Can I jump in? Just thinking about our next meeting, which is June 15th, which will be here much sooner than we think. Time will fly. I wanted to throw out another possibility. If there were areas from Tim's presentation that were of particular interest to folks, perhaps an alternative to sending out a survey, because we do only have basically 4 weeks. If people have a particular interest in an area, if they would take a look at the bills that were included in the packet and get back with us within, say, a week on any areas that they think we should consider adding to the straw man. And that would give us 3 weeks as staff to kind of be thinking about a straw man and getting the materials ready for the next meeting.
So I think that's a good idea, David. Maybe we could do a kind of a combined thing rather than do a survey, ask for folks to do that, because I think everyone can look and let us know. Rather we could, send something out and have you check boxes. But if everyone is willing to take responsibility to just take a look through, let us know what you're interested in. We could still at that point, David, I think we can take what they've focused on, but we could still share it out with sort of smaller groups and just say, hey, here's based on what people were interested in doing the deeper dive on, here's something for you to take a look at with a couple other folks. And so I feel like if you've got 1 or 2 things assigned, that might be easier to feel like you're trying to wade through everything. So that would be then we wouldn't send a survey, but people would let us know what they're most interested in. Then we would use that information as we're building our straw man. But given that we've decided that our straw man will kind of be, focused on our current program, and then we're going to have some additional recommendations, we can take that to help thinking about other pieces, and people will still have some time to do a deeper dive in those smaller groups. Did that make sense? So
sure.
We'd have what we need to develop the straw man, especially if there's pieces from what people are doing out there now in other states that really could tie in and are similar to what we're doing and really would make sense in terms of our program. Those are the places where it would be really wonderful to know sooner rather than later, hey, they're doing something similar to what we do, but here's how they do it a little differently, and it really seems to be a good approach. But then for some of these ideas that are really very different than what we're doing, and I think that would be helpful just for folks to take a deeper dive, and we'll sort of think of those a little bit separately than the straw man.
Okay.
Can we clarify our next steps by email in the next by Monday, so the group knows what direction we're going in and how that would look?
I think that's a good idea, Ginger, because clearly we're all trying. David's the one who's trying to manage this process, so I want to be respectful of him and the time that he has and not try to bite off more than we can chew, which is easy to do. I think we're all very excited about getting the information back from Tim. But yeah, if that's okay, we'll do that. I think we've got some good ideas. We'll make sure, we get input from the work group in terms of all this work that has been done, and hopefully in a way that will work well for everyone. And, and everyone knows they're always welcome to spend more time if they'd like, but we'll try to keep it reasonable for us all.
So if you are on the meeting today and you have strong feelings about what we should do to treat what we've learned from other states, from Tim and his work on other states, please make sure you contact David Young and let him know what you're thinking so that we can balance that against staff resources and create a plan quickly and try to get that to you early next week. So again, if you have strong feelings and you want to chime in about what you think we should do next, contact David Young under separate cover, and we will make sure we consider that as we create a plan for moving forward. But we are almost out of time, like 3 minutes. So I just want to, unless there's any burning thoughts or questions or issues that you want to chime in on audio or put in chat, we will close out today's meeting. I just want to again say thank you to everyone. Everyone minded their mutes really well. There wasn't a lot of distraction, so that really helped the meeting and the efficiency of our conversation today. So thank you for being mindful of that. We really appreciate your contributions today as well. And we look forward to meeting with you again on June 15th. But again, you'll be hearing from us early next week for the plan to consider what's happening in other states. Well, everyone, have a lovely Thursday evening. And again, thank you for your time today. We'll see you soon.
Yes, thank you all very much. Bye-bye.
Thank you.
Thank you.